Good afternoon. I'm Mandy Cohen, the Secretary of the Department of Health and Human Services for North Carolina, and I'm joined by Director Mike Sprayberry. We have Brian Tipton and Nicole Fox as our American Sign Language interpreters, and working behind the scenes as our Spanish language interpreters are Jackie and Jasmine Matevier. Well, thanks for joining this afternoon, and I'll start with a rundown of our numbers. As of this morning, there were 6,764 cases in 93 counties. We have 373 people who are currently hospitalized, and sadly, there have been 179 deaths. To put that last number into context, North Carolina has had 167 flu deaths this past season. And that flu season started all the way back in last September. And remember, for COVID-19, we had our first laboratory confirmed case on March 3rd, our first death reported on March 24th, and that was less than a month ago. So in less than a month, we've already surpassed flu deaths for this year. COVID-19 is now the leading cause of death in the United States. And it's important to remember that our death rate would have been worse, unfortunately, had we not taken the aggressive action as a state to slow the spread of the virus. We've done hard and important work. North Carolinians have been staying home to save lives, to keep our loved ones safe, and to protect our frontline healthcare workers. Thank you. Thank you for that work. But many are doing that hard work, but also having tremendous hardship to themselves and their families. We understand that sacrifice, and we continue to aggressively pursue every resource we can to help North Carolinians who are struggling because of COVID-19. Since schools closed back on March the 16th, school nutrition and transportation staff have worked tirelessly to ensure children continue to receive meals while out of school. Since then, about 1,000 meal sites have served over 11 million breakfasts, lunch, and dinners across our state. Remarkable. And going forward, the good news is families will now have even more help. Just before today's briefing, Governor Cooper announced that North Carolina is one of 4 states to be approved for the new Pandemic Electronic Benefit Transfer Program. This program will help families purchase food for more than 800,000 children who normally receive free and reduced lunch at school. Families will receive $250 per child, provided in 2 installments, paid for with federal funds. Families will not need to apply. Those who are eligible and already receiving food and nutrition service benefits will get the additional benefit on their EBT card automatically. Eligible families not already enrolled in food and nutrition services will receive an EBT card in the mail in the next few weeks. This new program is in addition to other food security efforts. As announced at the end of March, all families that receive food and nutrition services are receiving the maximum amount allowed for their household size for March and April. In March, the department issued $75 million in benefits to 400,000 households that accounted for 850,000 individuals. Parents who need food assistance for their children can text Food NC to 877-877 to locate nearby meal sites. And the food texting service is also available in Spanish by texting Comida to 877-877. I know that these are challenging and uncertain times for everyone. I want to draw your attention to 2 additional helplines to connect people to mental health support services. You've heard them from us before, but we hope that they can help you during this crisis. The first is Hope 4NC Helpline. It's a mental health resource to support North Carolinians during this whole COVID-19 crisis. Call 1-855-587-3463 for support 24 hours a day, 7 days a week. And we have a second line, Hope for Healers helpline, available for our healthcare workers experiencing stress. Call 919-226-2002, and there is help available when you need it. With that, I will turn it over to Director Mike Spearberry for an update.